Austin CyberKnife offers alternative treatment to typical radiation or surgery for cancer patients. Even better, patients can almost always take up where they left off with their normal activities right away. Dr. Doug Rivera is a radiation oncologist and medical director of Austin CyberKnife and Austin Cancer Center. He joins us with more. Thanks for coming today, Doctor.
Thank you for having me.
So we're talking about the benefits of CyberKnife for treating metastatic cancer. Can you explain what that is, first of all?
Yeah, so first of all, so a lot of patients say, what is metastatic cancer? When people have tumors, they think of tumors. And when things are benign, essentially that means that cells in our body make errors, they start growing, but they typically just stay where they are. What makes something a cancer is when the cells kind of develop the ability to go to other parts of the body. So that metastases refer to a cancer that starts in one area and goes to other parts of the body.
Spreads to other places. Yeah. So CyberKnife, tell us about that technology and how you go about treating tumors with.
Right. So for this type of technology, metastases in general, we would think, when things go else places, we think of chemotherapy, and that is, something that goes all over the body, and a lot of side effects from that, depending on what it is.
Oh, yeah.
Radiation typically is something that's kind of more localized in some area that we treat to a very small area. What we're starting to see now, a lot of people are living a lot longer with metastases, very advanced disease, in part to many different things that, have evolved, the systemic therapies, chemotherapy, targeted therapies, but also radiation too. So the thing that I wanted to touch on was this idea of something called oligometastasis or few metastasis. So it's somewhere in between where you might have a tumor in one area and you might have many tumors in other areas. There's these cases where people would normally be considered to have, metastatic disease, but have maybe one or two lesions somewhere in the body. And it's been shown in more recent data that if you're aggressive about treating those lesions, even though they've gotten outside already, it can really, increase people's survival and make them live longer. So the question, though, is how do you do that in a way that can be, beneficial, but also not offer a lot of side effects?
Yeah, and it is so non-invasive, right?
So what the CyberKnife does, in particular, then, is a type of radiation treatment that can go in there non-invasively. There is no pain associated. It's a high-energy type of thing that goes in, and we pinpoint it so that people don't feel it as it goes in there, but then it does work on the tumors. So what the CyberKnife does, which is different than other machines, though, is that it's very pinpoint and very accurate, precise, we say.
Yeah.
And therefore, we don't expose a lot of normal tissue to the radiation. And by doing that, we can really bring up the amount of radiation, so that allows it to work better, minimizes the side effects because it's not touching the normal tissue very much. And then also, we can actually decrease treatment times, which courses may take many weeks to do, because we're able to, again, not treat the normal tissue, put a whole bunch in there to make it effective. We can also, decrease the amount of time it takes to deliver the treatment.
And people can get right back to their lives, right?
Absolutely, yeah.
Thank you so much for being here today. Great information. We appreciate it very much.
Thank you.
And Austin CyberKnife is located on I-35. You can give them a call at 512-324-8060 or go to austincyberknife.com. After the break, finding a financial advisor you can trust.